As a man, you know your body better than anyone else. But when it comes to prostate health, changes can sometimes sneak up on you. That slight discomfort, the extra trips to the bathroom at night, you might brush these off as just part of getting older. But what if they're trying to tell you something important? An enlarged prostate isn't just an inconvenience. It can significantly impact your quality of life. Known as benign prostatic hyperplasia, or BPH, it's a condition that affects many men as they age. It's not cancerous, but it can cause urinary symptoms that affect daily life. As the prostate grows, it presses against the urethra, making it harder to pass urine. But here's the good news. You don't have to simply live with the symptoms. Early recognition of warning signs can lead to effective treatments that significantly improve your quality of life. Do you find yourself waking up multiple times at night to use the bathroom? This could be a sign of an enlarged prostate. When the prostate grows, it puts pressure on the urethra and affects bladder function, causing you to urinate more frequently. If you're constantly running to the bathroom, especially at night, it's time to pay attention. This is one of the first signs that your prostate may be growing. Have you noticed a change in your urine flow? A weak or interrupted stream could signal an enlarged prostate. When the prostate presses against the urethra, it makes it more difficult for urine to flow freely. If you find yourself straining to urinate or notice that your stream starts and stops, don't ignore it. These symptoms may worsen over time if left untreated. An enlarged prostate can make it feel like your bladder isn't fully emptied. You may feel like you still need to urinate even after you've finished. This sensation, known as urinary retention, can be uncomfortable and harmful if it becomes chronic. Signs of this include feeling like your bladder is still full after urinating or needing to go again shortly after finishing. If this is happening to you, it's important to address it promptly. Do you ever feel a sudden, uncontrollable urge to urinate even when your bladder isn't full? This feeling of urgency is another common sign of an enlarged prostate. The pressure from the enlarged prostate on the bladder can cause this strong urge, making it difficult to wait. If this is happening regularly, it's time to talk to your healthcare provider. Prostate enlargement can cause this sudden urgency, which may even lead to leakage before you get to the bathroom. While not often talked about, changes in sexual function can also be linked to an enlarged prostate. If you're noticing difficulty maintaining an erection, decreased libido, or changes in ejaculation, your prostate could be playing a role. These symptoms can stem from several causes, but if you're experiencing them alongside urinary symptoms, it's worth discussing with your doctor. Recognizing these warning signs is the first step toward maintaining your prostate health. If you're experiencing any of these symptoms, don't wait. Consult your healthcare provider to determine whether your prostate is enlarged and discuss possible treatments. In addition, there are a few ways you can help support your prostate health. Get screened. Depending on your age and risk factors, talk to your doctor about when to start prostate screenings. Exercise regularly. The American Institute for Cancer Research recommends 150 minutes of moderate or 75 minutes of vigorous exercise per week to support prostate health. Consider supplements. Saw palmetto, stinging nettle, and lycopene are natural ingredients that may help manage prostate health. Talk to your doctor about including these in your routine. Prostate health is an important part of your overall well-being, and recognizing these warning signs early can help you take control. Stay informed, stay proactive, and make sure to seek the right treatment options for a healthier, more vibrant life. Have you noticed any of these signs in your own health? What steps are you taking to stay ahead of potential prostate issues? Leave the comment below.